Ideally, your orthotist or your AFO provider is the one that's managing the actual mechanics of the device. So the first suggestion is that you're scheduled regularly for checkup visits. So whether that is with your orthopedic provider or whether that's with the actual boot and bar provider, the orthotist, but monitoring the fit of the AFO is really essential to the success of your child, because we're going to make necessary adjustments along the way. Another thing that we can do during appointments with your Cuties Care teams is they might actually apply blister prevention products, such as the silicone tongue here. So removing the leather tongue, adding the silicone tongue. This actually is created in a way that is helping to minimize friction inside of the boot and the bar, and that will again help to relieve any sort of potential pressures or sores later on. Also, we are creative beings. Like, we will find a solution to make the device better for you. Another suggestion that I've made in the past is crisscrossing the straps so that there's a nice little X, which gives just a little bit more contact over the dorsum of the foot, and that helps to hold the heel down. So there's lots of ways to manage that, but it's really at the direction of the provider. Again, you should not feel like you're alone on an island trying to make these decisions by yourself at home. Even if it's over a weekend, just send it into your care team. Some of us do check our emails over the weekend and make sure that everyone's well and supported. But again, if you're having concerns, some ways to minimize it are just keeping a really close eye on it and making sure that you're seen by your provider team on a scheduled basis. Doesn't have to be a specific time, but a regular check-in on the AFO fit is really necessary. And then go back again to that basics. Nice dry environment, the skin is clean, and that will help to prevent any sort of skin infections if you do end up with an actual open sore.
Yeah, and I think that's such a good point for parents too, what you said about taking your break from it too, if necessary. Like, if you are in an in-between and it is Saturday night and you're like, I have an open sore and you can't get in to see your provider, like, it's not gonna make or break your child's overall treatment. It's really important that long term your child is able to wear the boots and bar. So if we need to make minor adjustments to ensure that that is successful long term, then it's okay to do that. Honestly, it's in the best interest to make that happen. And I think sometimes parents need reassurance about that, because it's kind of really drilled into us that we need to be diligent and adhere to the schedule, right? But sometimes we have to be able to flex based on what's happening with our child during that moment.
I always tell families, if it's a day or even 2 days out of the device, that in the long run is nothing when you spend weeks or months out of the device. So again, staying diligent, being eyes and advocating for your child's skin, like that's all you have to do, and getting a minute is good. But if we need to take a break, we take a break, and that's a-okay.